how can I get off Ambien? That's something for your doctor to help you with. What I generally find is that after 12 months of good progress on the guaifenesin protocol, many people are able to decrease or eliminate other medications that they're on. But it usually takes a year of good nodule decrease before they are feeling well enough to make this change. Sleep is one of the biggest issues that many of us with fibromyalgia have, meaning lack of sleep. So they've done studies on the sleep in people with fibromyalgia, and they find that we spend less time in deep restorative stage 4 sleep. It's like when we get to stage 4, an annoying little brother is poking our muscles and waking us up, and then we go back to stage 4, and then we get poked again, and then we go up and down. And of course, we're not going to feel well if that happens. And I remember about a year and a half on the guaifenesin protocol, I started to wake up feeling rested, and that's been such a blessing. And so that's the goal, is to return to good health using the guaifenesin protocol and the other things, the 5 game changers, and the other things that are most helpful for your individual situation. So sleep is crucial, and also excellent studies have shown that half of people with fibromyalgia have obstructive sleep apnea, even without the risk factors of obesity or snoring. So it's about 49% of us. And so this is so high that if I see a new patient 30 or over, I recommend that they get a sleep study. And it's held true in my patients that 50% of them have obstructive sleep apnea. So why is this important? If you're not getting enough oxygen to your brain and body at night, of course you're not going to feel well. And so this is something else that it should be part of a game changer, getting enough oxygen to your brain and body. It sounds so simplistic, but this is really important. And there are a lot of more comfortable oxygen delivery devices now, but I've had a number of patients where, let's say they're 32 years old, and they're a slim female, and their primary care doctor is grumbling as they're writing the prescription. Sleep study, I can't believe it. Comes back positive. And they start the CPAP machine, and they feel so much better. So there's something called the barrel hypothesis that I was talking to someone about. So think of all of the symptoms you have as filling up a barrel, and you only have, think of the conditions you have as filling up a barrel. You only have symptoms when the barrel overflows. So let's say you have fibromyalgia, you have carbohydrate intolerance, you have obstructive sleep apnea, and so your barrel's overflowing, you feel crummy. So you go on the HG diet, that reduces what's in the level that's in the barrel. You get treated for your obstructive sleep apnea. You use guaifenesin, your nodules decrease. You're not gonna have as much overflow. You're gonna feel better. So that is an advertisement for really finding out what all of your conditions are and treating them.